Hi everyone, my name is Dr. Nkendong. I am a psychiatric nurse practitioner. I also hold a Doctor of Nursing Practice degree. In today's video, I will be talking about personality disorders. The Diagnostic and Statistical Manual for Mental Disorders, commonly known as the DSM-5, classifies personality disorders into 3 clusters. It is important to understand these clusters when working with individuals who have personality disorders. Before I go any further, I would like to say this information is intended for educational purposes only and is not a substitute for professional medical advice. Always consult your healthcare provider before making any medication or lifestyle changes. Let's delve into each cluster and explore strategies for supporting people in each cluster. Cluster A encompasses paranoid, schizoid, and schizotypal personality disorders. Those with paranoid personality disorder often struggle with trust and harbor suspicions towards others. They hold beliefs that others intend to harm them, doubting the loyalty of friends and family. Consequently, they are hesitant to confide in others due to fear that their information might be used against them. Individuals with this disorder tend to interpret remarks or non-threatening situations as insults or attacks. Moreover, they tend to hold grudges over perceived wrongdoings. In the case of paranoid personality disorder, it is not uncommon for someone to suspect their spouse or partner of infidelity. Moving on within cluster A is schizoid personality disorder. These individuals typically display a disinterest in connections, often prefer solitude over engaging with others. Additionally, they may lack interest in pursuing relationships. Lastly, we have schizotypal personality disorder within cluster A. People diagnosed with schizotypal personality disorder exhibit distorted thinking, beliefs, speech, or behavior. They may experience occurrences like hearing voices or harboring idiosyncratic thoughts. These individuals often display a lack of expression and demonstrate socially atypical emotional responses. They also tend to experience anxiety and struggle to form connections with others. One distinctive trait of schizotypal personality disorder is the presence of magical thinking. This refers to the belief that one's thoughts can influence people and events, well as the notion that seemingly random incidents hold hidden messages. To effectively interact with individuals exhibiting this cluster of symptoms, it is crucial to establish trust, respect boundaries, and provide a predictable environment. Next, we have cluster B, personality type. Cluster B personalities include borderline, histrionic, and narcissistic types. People with borderline personality disorder often possess a fear of abandonment, struggle with persistent feelings of emptiness. Their relationships with friends and family tend to be unstable. Individuals with borderline personality disorder frequently experience mood swings referred to as mood lability. They may display self-harming tendencies, engage in behaviors that could potentially lead to suicide ideation. Additionally, anger is an emotion they express along with actions such as engaging in risky behaviors like unsafe sex, gambling addiction, or binge eating. Next on cluster B personality is histrionic personality disorder. Histrionic individuals consistently seek attention from others. This individual tends to be excessively emotional or dramatic, may intentionally provoke feelings to gain attention. They exhibit behavior speaking with passion and strong opinions but lack substantial facts or evidence to support their claims. Moreover, they often place emphasis on appearance and tend to perceive relationships as closer than they actually are. Moving in cluster B is narcissistic personality disorder. Narcissists hold the belief that they're special and more important than others. They frequently indulge in fantasies of power, success, and being admired by others. A narcissist struggles to understand the needs and emotions of people instead of expecting praise and admiration. Furthermore, this individual consistently feels superior to others, often complains about people while also expecting favors from them. Additionally, a narcissist commonly takes advantage of people. A narcissist believes that others are envious of them. In the cluster B category, we also have antisocial personality disorder. Individuals with antisocial personality disorder demonstrate no concern for the needs or feelings of others. They frequently engage in dishonesty and theft, use identities for deceptive purposes. This person has a history of repeated encounters with law enforcement agencies due to their disregard for the rights of individuals. People with antisocial personality disorder tend to display behavior. They can be quite violent at times. They show concern for their safety or the safety of others. Their behavior is impulsive and often reckless. They don't seem to feel regret for how their actions impact the lives of others. When working with individuals in this group, it is beneficial to establish boundaries, maintain expectations, and provide opportunities for self-reflection. reflection. Cluster C personality disorders include dependent, avoidant, and obsessive-compulsive personality disorders. Avoidant personality disorder is characterized by a heightened sensitivity to criticism or rejection. Individuals with this disorder often struggle with feelings of inadequacy and insignificance. They tend to avoid participating in activities that involve interaction with others and prefer isolation. They are not inclined to try things or meet people. In situations or when dealing with others, they display shyness and fear, disapproval, embarrassment, or being ridiculed. Moving on to the personality disorder within cluster C is dependent personality disorder. People with this disorder excessively rely on others, have a need to be taken care of. They tend to be submissive or clingy towards others and fear having to take care of themselves if left alone. They struggle with self-confidence. They seek advice and reassurance from others for minor decisions. Initiating or completing projects is challenging for them due to a lack of self-esteem. People with dependent personality disorders find it difficult to express disagreement with others. These individuals tend to tolerate mistreatment or abuse even when alternative options are available. They frequently feel a sense of urgency to start relationships after ending another. Moving on to another cluster C personality disorder, we have obsessive-compulsive personality disorder. Those who have this condition tend to focus on details. Individuals with obsessive-compulsive personality disorder are often inflexible regarding morality, ethics, and personal values. Their pursuit of perfection makes it difficult for them to complete tasks. They struggle with delegating responsibilities and prioritizing work or projects over socializing and enjoyable activities. Similarly, their inflexibility regarding values remains consistent. Symptoms and behaviors can differ from person to person, so there's no one size that fits all solutions. So it is paramount to tailor your approach to the specific need of the patient. Also, it's important to distinguish obsessive-compulsive personality disorder from obsessive-compulsive disorder, which is an anxiety disorder. Additionally, it's crucial to differentiate between personality disorders and mental illnesses as they are different. Your personality is influenced by a combination of genetic factors passed down by your parents. Your environment also plays a role in shaping your personality, including the surroundings you're exposed to, such as life events you've experienced or witnessed, and the dynamics of your relationships with family members and others. In contrast, mental illness typically involves thinking and behavior over which individuals may have limited control. Mental illness can be transient or recurring and may require management, whereas personality traits are more deeply ingrained within an individual's core being. Just as the seasons change but the climate of an environment remains relatively constant. For instance, Arizona is famous for its arid climate. We also experience a monsoon season that brings along storms. Like an illness, the monsoon season may come and go, while the heat, comparable to one's personality, remains constant. Additionally, one's personality plays a role in how an illness presents itself. For example, someone with depression and dependent personality disorder may exhibit the same symptoms of depression differently compared to someone with narcissistic personality disorder. A narcissist experiencing depression might attribute their condition to people and blame others. On the other hand, an individual with dependent personality disorder might struggle with self-care and frequently seek guidance from others on managing their medication and potentially neglecting self-care as a result. That concludes my thoughts for today. I hope you found this information helpful. Feel free to share this video with anyone who could benefit from it, and remember to subscribe to my channel. Thank you for watching.